Good day and welcome to Patient and Family Care Study. My name is Afam A.J. Charles Jr. and I'll be taking you from Model 6 today. So we've done Models 1 to 5 and we are now going to learn Model 6. Model 6 talks about how to do the work, how to write the care study. So with that, we'll be looking at how to select a patient, how to get the patient's consent to do the care study, or for the patient to accept you to use his condition for your write-up, and your preparation for the care study, the things that you need for the care study, and how the care study is going to go, and how the tables and all that come into play. So that is basically what Model 6 is going to talk about. So starting with how to select a patient, you need to read and examine the patient's folder. And when I say read and examine the patient folder, you have to assess the patient, what kind of patient you are going in for. You read the folder, you come abreast with what the patient's condition is and all that. And you have to identify problems that are actionable. So what I mean by that is you are going to provide, in care study, we prefer that you provide total care to the patient, total or semi-care to the patient. So if you get a patient who has, let's say, malaria, and it's not even cerebral malaria and just the normal malaria that we know, and the patient is quite strong, then there's not much you can do for the patient apart from checking on vital signs and serving medications and food. But we need a patient that you can dress wounds, do bed baths, feeding through NG or through mouth feeding, oral care, and all that. So when we say action, so that you can be able to identify problems of the patient, that you can take care of that patient. That's what we mean by reading and examining a patient's folder, and also getting a patient where you can identify problems that are actionable. So you also have to consider the diagnosis. Then you evaluate the prognosis. Because you are not God, but you can look at the patient and know that this patient might be good for care study or not, looking at the state in which the patient is in, his prognosis, and also the comorbidities. So if, let's say, a patient has end-stage renal disease and he's in renal failure, 4th stage, and has a lot of comorbidities like hypertension, diabetes, bilateral pneumonia, among other things, which that makes his prognosis not too good. Because when you evaluate a case like that, and though you can use for a case study, sometimes it's a bit risky, but you have to take into account all these things to help you select a patient. You also have to liaise with your supervisor, who would tell you if a case is good or not. And this is the process of selecting a patient. So moving on to patient accepting your proposal. So initially, or first and foremost, you have to admit the patient yourself. Then after you have admitted the patient through the admission process, you build a good rapport with the patient and family, and also if there are any other significant others. And as part of your admission process, you have to reintroduce yourself. At the beginning of or as part of the admission, you would introduce yourself as a nurse, or you introduce yourself mentioning your name. So, for example, I'll say, my name is Charles. Welcome to medical ward. These are other. So as part of that, but when you are going for patient to accept your proposal, you have to introduce yourself by mentioning your name and also stating that you are a student nurse and you are in your final year getting a case for care study. So as part of it, you have to introduce yourself to the family of the patient and the patient himself or herself, and tell them that you are a final year student and are taking a patient and family care study. which is impartial fulfillment of the award of a license to practice as a registered general nurse by the Nurse and Midwifery Council of Ghana. So when you do this, you also have to continue by ensuring that patient and family understand that your write-up is for academic purpose, and you will maintain confidentiality. So you already have a good rapport with the patient, and you've told the patient that any information that he or she would give you, you would keep it confidential and you will not expose it. So all these things build trust. And you also have to explain into details or exactly what your role is and its implications. And what this means is you will not be the only one taking care of the patient. Even though you are taking that patient for your care study, it's a teamwork. There'll be other nurses and doctors and physiotherapists, pharmacists, dietitians, and all that will be also seeing the patient. So it's not just your patient. You have to explain this to the patient so that there are times where people take patients for care study and the patients end up refusing care from other caregivers, saying that if, let's say, Charles is not there, he will not take his medicine, or if Charles is not there, he will not eat, which shouldn't be the case. You have to let your patients understand that it's a teamwork. You will be playing a role. You would be playing a role, but he also has to receive care from other caregivers. And you have to allow the patient time to process the information that you've given him or her. You have to, when you've told the patient, because this is normally done when patient is newly admitted to the ward and the patient is already sick and might be overwhelmed or anxious and all that. You have to allow the patient time to process the information that you've given him or her so that it will enable him or her to accept your proposal. So that is with acceptance of proposal. Then for the preparation of the care study, you need some items or commodities. You need a lot of time. So as a final year student, even though you are writing your care study or project work, you are preparing for licensing exams, you have final exams coming up, you still have to create time, and you also have to have patience. When we say you have patience, sometimes when you get to the ward, you will not immediately get a patient of your choice. You have to be patient. You have to take your time in selecting a good patient. So sometimes people choose patients and they end up not giving them the information that they need, or they end up being troublesome, being difficult, and all that. You also need money. Money because sometimes I know you'll be going with the school bus or you'd be going there through the school's help, but sometimes you have to sacrifice and let the school bus leave you because you'll be providing care to your patient. And coming back, you will need money. You will need money to come back and all that, even though you paid for transportation. So you need some money, and you also need money to visit the patient's home environment. Go in there, you have to pay for your transportation to get there. And you need a laptop to type the work and all that. You need a small notebook and a pen to take notes because you'll be interviewing the patient and relatives. And you also have to document other little things here and there. So you need a small notebook and a pen. So the write-up format for the book itself, the font style should be Times New Roman. The font style size, should be 12. The spacing should be double line. The major headings should be in upper cases, bolded and center aligned. So I would show you an example of what we mean by it should be upper cases, bolded and center aligned. Sub-headings must have each letter of the word capitalized and also bolded, and major headings and sub-headings can be numbered or not. So the next slide will show an example. So when you look on it here, you can see that the example. So chapter 1, which is assessment of patient, it's bolded, it's Times New Roman, and it's center aligned. It's in the middle. That's what we mean by center aligned. And it's numbered, so 1.0. And these are sub headings. So subheadings like patient particulars and family and medical socioeconomic history, which we did in Model 1 or Chapter 1. So this is it. So you can decide to either use the numbers or not. You can decide to exclude the numbers and just have Chapter 1, assessment of patient and patient particulars and family and medical socioeconomic history. But if you choose to use the number system, you have to continue to number it till the end of your write-up, through till Chapter 5 is all has ended. So moving forward, so each major heading must start on the first page. So Chapter 1 must be on the first page, Chapter 2 must also be on the first page, Chapter 3, Chapter 4, Chapter 5, they all should be on first pages. And some subheadings must start on first pages. So for example, admission of patient, which is 1.7, should be on the first page, preparation for discharge, and rehabilitation, that is after your summary of actual care rendered, it also has to be on the first page. First home visit must be on the first page, the summary, the conclusion, and the bibliography, should be on first pages. So tables. There are 4 tables in your write-up. The first table talks about diagnostic investigations of the patient. Table 2 talks about clinical features exhibited by the patient compared to clinical features in literature review. Table 3 talks about pharmacology of drugs, and Table 4 talks about nursing care plan. So you know about landscape mode because you've done ICT. So your tables have to be in landscape mode. So tables must be in landscape as is written there. The orientation in page layout, that is where you will find the landscape feature. So I'm teaching you if you have forgotten. The orientation in page layout must be in landscape form, with the exception of Table 2. Table 2 talks about comparison of clinical manifestations in literature review to that of clinical manifestations exhibited by the patient. So that can be in portrait mode instead of landscape mode. But the other 3, Table 1, 3, and 4, should be in landscape mode. So each table should be on a new page. What we mean is that if the page is exhausted, each table should have on a new page and should have a heading. So Table 1, you can have, for example, about 6 diagnostic or laboratory investigations carried out by the patients. So an example can be hemoglobin estimation level, full blood count, chest X-ray, MRI, blood urea and electrolytes, and creatinine. These are all examples of diagnostic or laboratory investigations. So let's say 2 can fit on one table. So for example, full blood count and blood urea, electrolytes, and creatinine can be on one table, which is on one page, and should have the heading diagnostic or laboratory investigations carried out by the patient. When you go to a new page and you are going to write on the MRI and the CT scan, you should also have the heading Table 1, diagnostic and laboratory investigations carried out by the patient. That is what we mean. So each table on a new page and must have a heading. So it runs through for all of them. You do that for the pharmacology of drugs, and you do that for the nursing care plan as well. So we move on to assessment of patient. We've done assessment of patient as part of Model 1. So to get your information, you need to interview the patient and jot down salient points. In the case where patient is semi-conscious or unconscious, you have to interview patient's relative. Similarly, if the patient is a child, you have to interview patient's parent or caregiver or caretaker. So confirmation of patient's information is the same as validation of data, which we have talked about also in Model 1. You confirm this by you confirm some of the information given to you from the patient's folder. So when you interview patient will give you the information telling you that he was born here, he lives here, his date of birth is here, that's his date of birth and all that. So in the folder, you realize that we take some particulars from the patient, which is the patient's name, his date of birth, where he stays, and a few other things. So you can confirm that by cross-checking in the folder, and you know that the patient is telling you the truth. You also confirm other information by interviewing patient's relative and significant others. So the patient tells you that he was born here, he went to school here and all that. So you can confirm that by also interviewing the relative and significant others. And you also compare the patient's condition to literature. Then you can know for a fact that, let's say, a patient has stroke or meningitis or malaria or any other disease that is on the folder or patient says he has. So the literature review, which we have talked about also in Module 1, is directly from a textbook, a journal, or an article. And it should be referenced in your bibliography. So it's direct copy and paste from either you are typing it from a book or you got it from the internet, which is copy and paste. So moving on to Module 2 or Chapter 2, we have diagnostic and/or laboratory investigations. So with that, you have to take note of all the diagnostic and/or laboratory investigations that was carried out on patients. So I listed a few of them. Then you have to have copies of your own, taking note of the date of request, the date the investigation was requested, the investigation itself, and the results. Some students end up leaving the hospital or leaving when patient is discharged, then they realize that they don't have copies of these. Then they have to go back and look for the folder and all that, which is worrisome. So when you are drawing up your plan, you have to add it so that you get copies of the investigations, the results, and the dates and all that, taking note of these things. So moving on to, same goes for the pharmacology of drugs. You have to take note of all the medications which are administered to the patient. You have to have copies of the treatment chart. You know about the treatment chart in the nurse's note. So you take note of the date of prescription or the date patient started taking the medication. The medication itself and its rights. You know about the rights of medication, the right route, the right dose, the right dosage and all that, which you need for your pharmacology of drugs. You also take note of side effects which were observed in the patient, and if so, which remedies were given or what was done to curtail or to treat these side effects. So we move on to Module 4, Chapter 4, which talks about summary of actual nursing care rendered. We've talked about Module 3 or Chapter 3 extensively, so I don't think you should have problems with that part. So moving on to the summary of actual nursing care rendered. In the summary, you should talk about the time the patient woke up, and when the patient woke up, if he or she had any complaints, how the patient maintained his or her personal hygiene, and with that, maybe you did a bed bath, or it was an assisted bathroom bath, or whatever it was, you state it and let us know. Patient brushed his teeth with toothpaste and toothbrush, or he used a chewing stick. The administration of medications throughout the day should also be there. Patient may take his medications in the morning, in the afternoon, and also in the evening. And you talk about nutrition, unless of course patient is on nil per os. So you talk about nutrition, whether it is NG tube feeding or spoon feeding or patient ate it himself. You let us know, and you include ward rounds. Ward rounds is also part of the summary, and vital signs throughout the day. We check vitals in the morning at 10, at 2, at 6, and also at 10 again. So you can choose to write that in there, or you give us a summary of the ranges, because it's a summary. So summary of ranges per the day, let us know. So vital signs checked throughout the day were temperature, for let's say from 36.2 to 37.2, pulse 86 to about 100 beats per minute, and so on and so forth for the vital signs. You include respiration and blood pressure. You also include visiting time, what happened during visiting time, who visited the patient, what they brought the patient, what they did for the patient, if they were in communication, they were chatting, they were laughing, all that. But you write it in a summary so that your work doesn't become too long. Bear in mind, it's a summary. So you talk about also when patients went to bed, what he did before bed, if there were any bedtime rituals, if he did, and if there were any other procedures or specific issues that happened in a day, you also include it in your summary of actual nursing care rendered. So we've come to the end of how to do the work. It's a simple thing. You would have supervisors and lecturers which will be there to help you write it. I'll be there personally to help you. My name remains Afam Ej Charles Jr., and I took you for patient and family care study. Thank you for your attention.